Dear Dedalus friends and family, welcome to HIMSS Middle East here in Riyadh. I have the pleasure of meeting up with an old friend, Rizwan Malik, who is from the NHS in Bolton. He also has his own radiology consultancy. Rizwan, welcome.
Thank you.
It's good to see you.
And you.
I wanted to start with just some basic questions that we ask everybody. And the first question really is, what brings you to the Middle East?
I see myself as a bit of an evangelist about the use of AI in health tech more broadly, but specifically in radiology.
Okay.
And there's a movement in the Middle East and specifically in Saudi about the use of it. They're exploring how they can make it effective, how we can improve patient care by the use of it. And I was drawn like a moth to a flame.
Amazing. Well, welcome. We're happy to have you here.
Thank you.
So, Rizwan, I know you're obviously in radiology quite often. What's the most exciting thing that you feel is really coming on board with the digitalization of healthcare? Maybe you can tell us specifically in radiology and beyond, if you don't mind.
If anything, it's the beyond, which I think is what's exciting me the most, insofar as it's not an and/or scenario anymore. We're breaking out of our clinical and workflow silos. We're having a lot more engagement across different spheres because healthcare is joined up. And it's right and proper that the systems we use are joined up as well.
Rizwan, with your radiology hat and maybe beyond that, could you tell us what you see as the most exciting part that's coming forward with the digitalization of healthcare?
Sure. I think the bit which I'm enjoying about it was healthcare is an interoperable environment, or it should be, because patients don't conform to textbook things. And yet we used to operate in very clinical silos, and the tech used to operate in those same clinical silos as well. Now we're seeing a lot more crosstalk. We're seeing software, we're seeing infrastructure, which transcends boundaries. And so we as clinicians are able to transcend those as well. And being able to be part of the wider system is what I'm enjoying most.
That's great. That's a great answer. Thank you. So Rizwan, our industry is changing year on year. What would you see is going to be the biggest change over the next 5 years?
I think in many ways it's a progression of what we just discussed, insofar as we're moving beyond having isolated systems, and because of that we're having to engage, and software is now being developed alongside the needs. In the past, clinicians were never engaged with software development. It was basically, we've bought you this kit, use it.
Right.
Whereas now we're able to feedback how our clinical practice is evolving and the software is adapting to that. And that's allowing, it's also breaking the boundaries between healthcare and the commercial world as well. Frankly, the ability to be treated like a professional grown-up and have the conversations is a helpful step forward.
So I guess the feedback loop, the professional feedback loop,
absolutely,
is helping the software become more intelligent, at the same time giving true value to the users.
Yeah, you know, we were always having to adapt our practice to what the software did, whereas rightly, given the amount of pressures, given the demands that there are, it should be the other way around. It needs to empower us to be more efficient.
Agreed. So Rizwan, I wanted to ask you, you've obviously been in the healthcare practice for a long time, and what would you say is the main difference that you've seen since you started to where you are now? I know it's been some years, but if you could say one or two things that stand out, what would that be?
Two things I'd say. The first one is obviously the move from the radiology perspective to hard copy imaging, you know, having to find light boxes, and to look at it, to the fact that we had an intermediate period where effectively digitization was nothing more than putting the same images on a screen, whereas now they're a lot more interactive, there's a lot more sharing of data across boundaries. The second one, which sounds a little bit corny, but it's being able to step out of the shadows. You know, as a radiologist, I was stuck in a room in a darkened environment, but again, that's not how we practice. Being able to engage with patients, being able to engage with other clinicians, and not just clinicians, being able to engage with a CTO, with a CIO, with other facets of the healthcare domain, so that we can all work together to improve the services we provide.
That's a great answer. Thanks for that. I have just one last one. I mean, there's going to be many radiologists and radiographers and many people who are getting into the healthcare IT industry. Is there any specific advice that you can give them?
I think what I'd really say is start with what you know. Don't try and be all person to all environments, because the skills that we provide are based on the experiences we have. And what we're trying to do is co-create around that experience. So if you're always adapting what you think the person wants to hear, you devalue the input you can give.
That's great. Thanks so much. Really pleasure to have you here, Rizwan.
Thank you.
Hope to see you again soon.
Thank you.
Thanks. That was brilliant. Well done.